Google and Alphabet have a number of initiatives on the COVID-19 front. Talk to us about where the money is being allocated and how.
Absolutely. Well, look, there's some good news in this moment, and that is that there are innovative nonprofits and universities, social businesses all over the world with really clever ideas on what we can do to stop the pandemic and address the economic devastation. So Google.org comes alongside of them with funding, with technical expertise from our Googlers to help make their ideas a reality. So some of the areas that we're working include health and science. As an engineering company, we're really committed to help getting better data, better analytics, better mapping, economic recovery as well. Super important that we immediately get direct cash to individuals, that we get digital skills scaled. And then areas like distance learning. We've got 1.5 billion learners around the world who can't physically get to school. So we're thinking about how can we support platforms like Khan Academy or Donors Choose who are reaching teachers and parents and students in this moment.
You've also got Google employees embedded in some interesting places like Boston Children's Hospital. Tell me about that.
Yeah, look, our superpower as Google.org is not only the $100 million that we can provide, but our Googlers themselves. So we send teams of engineers and product managers and UX experts, and they go out and work full-time for our nonprofits and our researchers that we're partnering with. So with Boston Children's University in Oxford, for example, they are figuring out how to use data analytics and machine learning to map the spread of COVID in real time, and that is helping to inform on, hey, what are the best approaches? What is actually working to help stop the spread of COVID? And in particular, the Googlers are helping them to take a prototype platform, a research platform, and actually make it scalable and robust and resilient and make sure all of the data that they're gathering is made available to other teams of researchers and governments around the world who can really also create other mapping solutions based on that data.
Now, you were also the former Deputy Director of Global Health for the Bill and Melinda Gates Foundation. We know that Bill Gates has been concerned about an outbreak like this for some time, but unfortunately governments were still caught off guard. This certainly gives you a unique point of view. What populations are you most concerned about? Like, who are you most worried about getting hurt by this pandemic?
Well, as a philanthropy, we want to particularly pay attention to those who are most vulnerable. You know, we are looking at people and communities who were marginalized and underserved even before COVID, because those are exactly the same groups that are being hardest hit both by the pandemic itself on the health effects, but also the economic devastation. So, for example, just right in our backyard, you know, our headquarters is in the Bay Area, and we saw such economic impact even locally with our neighbors in our backyard. So we teamed up with Give Directly, for example, because we know that providing immediate direct cash during a crisis can be phenomenally helpful. So we wanted to make sure we got $1,000 to families that were in desperate need. So, for example, these are families where 80% of the recipients were women, 41% single mothers, and 79% reported not having enough money or food to last for more than 3 days. So partnering to immediately get economic relief, but also looking at longer-term economic recovery options.
Right. The economic devastation, I know, is only just beginning to be felt. Meantime, Google has told employees that the majority of them should expect to work from home through the end of the year. You've got the president pressuring states to reopen now. Why is Google taking a more cautious approach?
Well, look, we were one of the earlier companies, part of the group of tech companies who actually started working from home earlier than the order went out. And our philosophy is that if we can work remotely, if we can work from home and help take some of the pressure off, help flatten the curve, then we're going to do that. So we will be going back to the office. We will have some of our workers who absolutely need to physically be on site be going back. But it'll be very gradual, and we'll be using, science to guide us in our decision-making about how quickly we go back.
So how are you handling this with your own team as you work from home and understanding the science? What is it that you're concerned about? Are you concerned about a continued health and safety risk?
I got to tell you, my team at Google.org, we are absolutely motivated in this moment because we feel like we can help be a conduit to help bring resources, $100 million, and also our Googlers, to people on the front lines who have really great ideas. So as much as we're all bearing some of the impacts personally, having friends or family members who are coming down with COVID, definitely had team members who have faced loss in their personal lives with family. We also recognize this is an unparalleled moment where we can all come together and build solutions at scale and be part of a global community of response, and that's super energizing as well.